Medicare is something we all have to deal with, particularly as we hit that magic age of 65. And we've got a great show that deals with a lot of the things that are facing folks that are this age. And it definitely there's a whole lot of people that are being impacted. And I'm going to bring in Toni King, and she's going to talk about simple ways to enroll and all along those lines. But she is the expert on this, and she's got a lot of great advice and great things to say about this very important issue and all along those lines. So I know we had torrential rain here in North Carolina yesterday, and I understand y'all had some torrential rain, but now we got a break and everything like that. So I was actually just talking to my mom earlier, and she's not going to get to stain her pool deck until probably a day or two from now because she's got to wait for the wood to dry and things before she can get the people to do the staining. So that's something I was talking to her about earlier and all along those lines. And she was saying that she had actually had a little bit of a dizzy moment as well. So she was having some health things that she was going on as well. But she's doing well, and I hope that you're doing well also. But I just was talking to mom, and I try to talk to her probably about 3 or 4 times a week and everything like that because she's getting up there in age. She's in her almost mid 80s. She'll hit mid 80s on next year and everything like that. But definitely getting up there in age. And of course, I'm not a spring chicken either. But it's always good to keep track of your parents if they are still living and everything like that. So I try to keep track of her and dad and do a much better job, like many men, with mom than I do of dad. But I do keep in track with dad as well. But how are you doing?
Okay.
And how are things going in your world?
How's things going in my world?
Yeah.
Things are going fine. I am going to the beach next week, so I'm fixing to go crabbing and fishing.
Oh, that sounds wonderful. I was just talking to somebody that went crab fishing and they actually caught some things. I think they caught a grouper and they caught something else here in the North Carolina area. We were on social media, but I think because they did not reach there wasn't the right size or something like that. I have to look at their Instagram post, but they basically had to toss it back. They weren't able to keep it and everything like that because there are certain rules and regulations that we have here.
Well, life we would not be American if we didn't have rules and regulations. And if you want to talk about rules and regulations, get on Medicare.
Oh yeah, plenty of rules and
Your day is
regulations.
coming, Mark.
I
We've
know
already discussed that last week. Your day is coming.
next year,
And
next
people
year.
don't realize there is no, oh, I didn't know I was supposed to do that. There's time limits as far as Medicare is concerned, and there are no do-overs. Saying I didn't know what I was supposed to do is not going to save you.
Nope, that would not
You
save me
get
at
no
all.
saving graces. So, however you want to do this today, we're talking about there's different ways that you can enroll in Medicare.
Yeah, and I want to hear
So,
about these
we
different
use
ways
you
to
as
enroll.
the example,
Please,
okay?
please.
Because right now, there's 69, 70 million people on Medicare. That is a number that everybody markets to. And people think that someone's calling them because they like them. They're calling them because you're on Medicare and you're a walking dollar sign. They don't realize that. So you've got to make sure that you're doing everything the right way or you're in big trouble. There is one person getting on Medicare or turning 65 every 8 seconds a day.
Oh wow.
Yeah. So you're part of that 8-second people whenever you turn 65 next July.
Yeah.
There's going to be 10,000 other people nationwide who are turning 65, 10,000 plus.
10,000 plus. Wow.
Yeah. So that's because when we were kids, they didn't have, there was no birth control.
Hmm.
And now there's birth control, so that limit is starting to shrink. It's going to shrink. So what we're going to talk about today is information. This is your Medicare New Handbook. And
Yes.
trying to decipher what's going on in here is amazing. That's why I made my book that you can get you can come to my website, which is tonysays.com, and download the book or download my new system, which is called Medicare First Steps, so that you don't get messed up.
Right.
And you're putting my phone number and everything's going down at the bottom, but you got to realize there are no do-overs with Medicare.
No do-overs at all. You got to do it the right way and everything like that. So people are thinking that they can just do it any way that they feel like it, but that is not the case at all. They've got to do it the correct way, otherwise they'll just be in deep trouble, is what you're saying. So they need to follow the rules and do it correctly, otherwise they will be suffering.
They will be SOL.
They'll be SOL?
SOL. And I'm not going to say what that means. That's stuff out of luck, but stuff stands for another word. But you're going to be out of luck. So there's when you get on Medicare, there's different pages in the Medicare and You Handbook. Page 17 through 19 semi explains to you what you need to do, but it doesn't tell you how to do it.
Right.
So if you're turning 65, there's 3 ways you can enroll in Medicare. Okay?
Mm-hmm.
Turning 65 and receiving your Social Security check.
Right.
If you're already receiving your Social Security check, then you're going to get your Welcome to Medicare kit, because the government agency that enrolls you in Medicare knows you're turning 65. That's Social Security. Social Security already knows you've turned 65. So you will automatically get your Welcome to Medicare kit, and it'll have your card in there.
Right.
Part A and Part B. If you're turning 65 and you're not receiving your Social Security check, that's going to be you next year, I think.
Yep.
Then if you are not working full-time with true employer benefits, okay? So if you have an individual health insurance plan, or you have no insurance when you're turning 65 because you can't afford healthcare.gov,
right,
then you want to go online and enroll on the Social Security website. You do not go to the Medicare website to enroll yourself. Social Security does all the enrolling. They keep track of it. And that's what you do. That's what's in this article that I wrote. And that's in the newspapers and everything. And I can email that to you, and you can put that on your Pod TV website, because it's very important. Social Security does all the enrolling. So when you're turning 65 next year and you're not on true employer benefits, you're not working for a company, then you want to go online and enroll. That's what I had to do.
Gotcha.
Now, if you're turning 65 and you're working full time and you have true employer benefits, then you can delay your enrolling in Part B. A lot of people don't know that, and they go ahead and enroll in Part B, so they're wasting their money, because Medicare is not free. It costs something, depending on what your income level is.
Definitely costs a lot of money and everything like that. Just really quickly, because I know that I don't have any kids. I've said that before, and everything like that. But my brother does have his 2 sons, my 2 nephews, and everything like that. So how much, as he is getting ready to approach that age in 7 years, because he's 7 years younger than I am, and everything like that, how much should his kids be thinking about some of these forms and having access to these forms? Because who knows, he might, I know that I just read recently that Danny Glover was diagnosed with Alzheimer's. My brother doesn't have Alzheimer's, but he's got other health issues and everything like that. But there's no telling what his health might be like in 7 years from now. So should family members, because I think you help with your sister's situation and everything like that. So should family members, like sons, be aware of where the documents are in case they have to help in the process?
Well, we talked about that last week. I mean, but you're always talking about somebody that's got 10 years before they have to get on Medicare.
Right.
We don't know what the rules are going to be in 10 years. I'm talking about what's happening today.
Today.
So anybody that is turning 65 and they're getting on Medicare right now, this is what the rules are. Everything changes, the basics of Medicare does not change, but someone that's getting on Medicare in 7 years, who knows what the cost and everything are going to be. You can't project what the government's going to do in 7 years.
They just
Nobody
did
knows.
something today. They just did something today because I heard something about like billions of people being impacted, and it was in. We didn't talk about it, but it was a news brief that I saw that I was going to bring up on our news show. But I did know that it was something that was passed today. I think it was passed today or yesterday. But they said it was going to impact like I think they said 36 billion. It was going to impact a whole lot of people, and it was something that just came down the pike today. So it just happened today, and it was a Medicare initiative. I'm gonna look it up and see if I can find it because I thought of you when I saw the article because
I don't know. You'd have to email me the article, but they're making different changes for next year as
Right.
far as Medicare is concerned. As far as Part D, they will not release what the numbers are for 2027 until like November.
And this was for
Okay.
supplemental. This was for, I remember it was for something. It was something to do with the supplemental Medicare that was the law that I saw that was put out today and everything like
Well,
that.
you
But
can email me that and we can talk about it in 2 weeks. But today we're talking about the different steps you need to do to enroll.
right.
And
That's what I want to know. What is the? Because like you said, that'll be in less than. Let's see. I was born on July 1st, so we're talking less than 48 weeks because this is the 29th. So this is the. It was 4 weeks ago that I was turned 64. So this means 48 weeks from now will be when I will be 65. So yes, for 52 weeks in a year.
but
So,
because your Medicare starts, because your birthday starts on July 1st,
right,
your Medicare will start June 1st.
right. So even
Okay,
less-
so we can talk about yours when March, April, May comes around next year because you're going to want to enroll in Medicare because that's the best insurance I've had. This is like how insurance used to be before they made all the changes with in 2007 they started the Medicare Advantage plans and the Medicare Part D and all of that. But this is how insurance used to be back in the old days. And people need to realize Medicare is not free. It's
No.
based on what your income is.
Right.
So you need to make sure that, they know exactly what your income is because we have someone called the IRS that you have to file taxes.
Right.
And you've got 4 different parts to Medicare. You got Part A and Part B. That's what's going to be on your card.
Right on the card.
You're going to have your Part A and you're going to have your Part B. If you enroll on Social Security prior to you turning 65 in, let's just say you want it to start June 1st, then we need to go online and enroll you probably April for it to start June 1st of next year.
You
Okay.
mentioned the cost of Medicare and everything like that, and I knew that it was not free. Now, I know that you know because I don't hide it and everything like that. Many of my friends and myself as well are in the arts and media. So it means that we don't make a lot of money and everything like that. So this means that we will have to find some sort of discount version of Medicare. And is there a discount version?
No, there is no discount version of Medicare. Original Medicare does not have a discount version. It depends on what your income is. And
Most
yours
of us
is going to
make
be
less
based,
than $50,000.
hold on. Yours is going to be based off of you being single.
Gotcha.
That's a whole different ballgame. Being married is for both of you. If
Right.
you're married, then you've got a different amount of money that they go by. But you
Right.
being single, if your income is more than $109,000 a year for this year, then you pay more for your Part B. But if your income is $109,000 or less,
Right.
your Part B is $202.90.
And that's across the board because most of my friends are in the arts and make less than $100,000.
Okay. I'm still working.
Right.
I'm having to pay more because I still work. But
Right.
it just depends. Let's not confuse it. Medicare has 4 parts. A, B, Part C, which is your Medicare Advantage plan. You have to have Part A and B to get that, and prescription drugs.
Right.
I'm talking with somebody after we get off this phone call who's totally confused. Even though he's got a nice company and he makes a lot of money, he is just so overwhelmed he can't figure out what he needs to do. And his is totally confusing. So you've got to take time. Watch out. If you go to a meeting that's going to explain Medicare, you got to realize they want to sell you something. Right. Nobody's giving anything for free. Free. There is no free.
Right.
So I know that the girl, I don't remember what her first name is, that
the founder, Kimberly Calhoun.
Kim.
Yes.
She's going to different Medicare meetings.
Right.
To learn Medicare, but that's different insurance companies promoting their product, but they'll give you the basics.
Right.
You've got to sit down and understand what the cost is, what Medicare is basing it off of income-wise, the whole 9 yards. And everything that I'm telling you is in my Medicare First Steps. And now we're going to have the Medicare Roadmap that really breaks it down. So you want to make sure you understand what you got to do. There are no do-overs.
No do-overs at all. You got to do it.
There's no do-overs. You screw up, you do it at the wrong time. You sign up for Medicare when you're first turning 65 and you get yourself a Medicare Advantage plan. And now you develop cancer and you want to come to MD Anderson. You're in big trouble. You want to go to Mayo Clinic. I mean, nobody knows what their future is going to be. The guy that was Superman,
Chris Reeves,
he didn't plan on falling off a horse and it totally changing his life.
Right.
So there are no do-overs.
No do-overs at all. And I know one of the things that people are probably thinking about here where me and Kim are is that they are probably thinking that this has some, and I know y'all have some in Texas as well, but this is considered one of the premier medical areas in the country, but it's not cheap medicine. But yeah, there's a reason that Durham is called the city of medicine because, of course, it's got the Research Triangle Park, which has a lot of pharmaceutical companies, and it's also got some of the top hospitals, many of them that are run by Duke University. But definitely it is considered the city of medicine. That's actually the nickname of Durham, North Carolina, and everything like that, because we've even had some drugs that were founded here, like Bayer aspirin way back when. I think it was Bayer. It was either Bayer or BC. It was one of them aspirins. But definitely that's been known as the city of medicine for decades and all along those lines. So some people are probably thinking that they can get some affordable health care that will not be impacted by Medicare, but we know that Medicare is going to be impacting them if they go to the clinic or if they go to the hospital.
You have the changes that happen every year.
Right.
Okay. I'm on original Medicare with a Medicare supplement.
Right.
I'm paying a premium for my Part B, but I also pay an extra premium for my Medicare supplement. My out-of-pocket is $283. That's it.
That's not bad.
So I'm in control. I can go to whatever hospital, whatever doctor, anything I want to nationwide.
Gotcha.
I do not have an HMO or a PPO.
Right.
They control, and we've said that before, they control whatever you're doing. So this article that I'm writing about the simple steps that you've got to do, you've got to make sure you're enrolling at the right time. That's very, very, very important.
No, that's vital.
There's nothing any better than original Medicare because it covers everything. Right. But Medicare doesn't cover your dental, your vision, gym memberships. Those are the extras that your Medicare Advantage plans, the HMOs and the PPOs give you. And that's what people bite on.
Yeah. So in this article, I know you're gonna probably have like a timeline and everything like that because you mentioned that I will probably have to deal with it in June because that's a month before my birthday and everything like that. But what is the um, steps in order as people are going from 64 to 65 and everything like that? So they should they start looking at plans now, or should they wait for these?
You need to wait until if your since yours is gonna your birthday is July 1st,
Yes,
you want to wait until after January to start searching.
gotcha.
Okay.
Okay,
Because everything's going to change.
everything.
I mean, you don't know what the Medicare costs, what everything's going to be prior to you getting on Medicare. You got to
Right.
sit down. The best thing to do is sit down with your doctor.
Hmm.
If you've got a heart issue, you sit down with your cardiologist and you ask them what's your best thing to do. I mean, things change. So ask them after January of next year. Don't worry about it right now. People start getting stressed and they think they're going to have the answer to whatever. So that's where we need to sit down with Kim and say, okay, Kim, what is it that you really want to do?
Right.
Where is it you really want your health care to go? Because there are no do-overs.
No
You
jewelry.
pick a Medicare Advantage plan with an HMO or a PPO, and then you've got a health issue. In your state, you may not be able to go to a Medicare supplement. Everything's state specific for the Medicare supplement. The Medicare Advantage, which is Part C of Medicare, is federal.
Without going into details and everything along those lines, but she doesn't hide it, and I know about it, as do other members of the organization, meaning Pod TV and everything like that. Will it impact her if she has pre-existing health conditions? Because she's got some health conditions. I think she even talked to you on the time she was on the show that are very severe health conditions. I know she goes to the doctor regularly, even now before she hit 65. So, will the fact that she has these pre-existing conditions, and I don't know all the details, I think of them, but I know they're pre-existing, and I know that they might even be life-threatening in some cases and everything like that. But will that impact her Medicare? The fact that she has pre-existing conditions.
When she first gets on Medicare, as far as most states are concerned, you have a 6-month window that you can get a Medicare supplement without having to answer one health question.
Okay.
After 6 months, it's like doing life insurance. You've got to answer the health questions.
Gotcha.
And if you've got end-stage renal disease, or you have kidney dialysis, or you have cancer, or you've got Parkinson's, or you've got serious heart issues, you want to sit down with your doctor and know which one's going to be the best way for you to go, because there are no do-overs. You don't get a second time.
You know, do over, and you said that several times, and I definitely agree with you on that and all on those ones. But I did have a question based on what you said earlier. I know some folks that are in their late 60s that either for a second time around or maybe even a first time around are going from being single, because yes, I've been single all my life and everything like that, except for the dating pool, but definitely have never gone the marriage route and everything. But I do know some people in their later life. Matter of fact, I got a friend that I think he's older than me, so he might even be at the Medicare. Matter of fact, he's at the Medicare age. I think he's already got Medicare. But if you say you turn 65 and you get married during that time before you turn 65, like maybe your 64th birthday and everything like that, will that impact the way that you handle it? Because some people choose to get married late in life. I don't know why, but they choose to get married late in life.
Well, that's another, we can do that as another meeting or another talk when we're talking about the premiums for Medicare. But Medicare is based off of income. So if you're someone who is married and your spouse passes away and you're 70 years old, your incomes come down because that person's income is no longer there anymore. So you go from a couple who's based off of dual people, for both of you being filing taxes, to an individual. I'm an individual. I'm single.
Yeah. But I
So
think
that's a whole that has nothing to do with your health care.
no,
That
it
has
got
to do with what your Medicare premium is.
yeah, because as you say
Today
that,
we're just talking about how to enroll. So if someone is enrolling in Medicare and they're already on their social security check and turning 65, then they're going to get their little Medicare welcome to Medicare kit. If someone is 65 and not working, that's, I mean, they don't have health insurance through an employer, then you got to go online and enroll because you're not getting your social security check. If someone is 65 and still working, then we want to see what their situation is, and I charge a consultation. I sit down with you. I don't care if you're in California or New York or Florida. You got to make sure you do this all the right way. So I do charge a consultation fee to sit down and discuss it. It's $150 for an individual. It's $250 for a couple. And I've saved one person $2 million.
wow, that's a lot to save somebody, and that's a good deal and everything like that. Now, there, particularly during the pandemic, there were a lot of people that became expatriates. The other founder has moved to Spain with his wife, and he's older than 65. But say that you're an expatriate and you are living in another country and everything. Can you consult with people in those ranges as well?
I can tell people what they need to do if they're now living in another country.
Right.
And they did enroll in Medicare when they turned 65. If you're working for a business, that's a whole different ballgame.
Right.
You're still working. But if you decided not to enroll in Medicare and now you want to come back to the United States and you want to, because now you have cancer and you want to go to MD Anderson, so you're going to move back to North Carolina or you're going to move back to Texas, that's a whole different ballgame.
Right.
And you will get a penalty for every year or every 12-month period that you did not enroll in Part B because you're no longer working.
Yeah,
so that's another talk at another time.
Another talk at another time. Speaking of another talk at another time.
Are you looking at my article that I sent you? What Medicare covers and doesn't cover? Medicare covers everything medically.
Yeah,
but it doesn't cover dental, vision, hearing, long-term care. That's not covered under Medicare.
Yeah, I saw that. And actually, I know some people that were getting long-term care because of health issues and everything like that. So they might have been going to those various facilities for long-term care. I know that my dad, even after his surgery, he was in one of those long-term care facilities, even though he's back home now and everything like that.
But even though your dad's back home, he's got a health issue. So if now he's back home and he's got a Medicare Advantage plan and he's going, this isn't going to work, I've got to go back to original Medicare with the Medicare supplement, he's got to answer health questions. And if he can't answer health questions, he's got to stay where he's at.
Right.
People need to realize there's no network with Medicare.
No, not at all.
I mean, you're in control of your health care, not an insurance company.
No, the insurance companies definitely don't need to be in control of your health care. And like you say, if you don't, what you don't know now could hurt you later. And that's definitely
and there are no do-overs with anything. So all people need to do is they can call me. You put my number down there, the 832-519-8664. The 8664 stands for Toni.
Yep.
So all you got to do is dial 832. There's no, it's a Google number. So you call, you leave a message. You've called it before and you just leave a message.
Yeah.
If they want to ask me questions, they can go to info@Toni says, Toni. I'm Toni with an I and not a Y, but why am I that? Mark,
Because you're a girl, not a boy.
I'm a girl.
Exactly.
And then the website is tonisays.com. I'm only going to say what's accurate with Medicare.
No, you're only going to say what's accurate. And I remember Toni with an I because actually I think that's the way that my cousin, I think she's a second cousin, spells her name. And that's also, I know for a fact, the way that my ex-landlord used to spell her name. And she actually had knee replacement surgery several years ago. I think it was knee replacement. But yeah, when I was living downtown Durham in a loft apartment, my landlord was Toni with an I as well, because she was a girl, Toni Mason.
But use your friend as an example. If she had to have knee replacement, then all her out of pocket is with an original Medicare, with a Medicare supplement, is her Part B. Once she hits that $283, you don't pay another penny.
No more pennies.
So I can't wait until next year when you and I start, you're going, but I want to pay zero. I don't want to pay anything.
Right.
Well, your maximum out of pocket could be $12,000 if you go with an Advantage plan.
Could be, definitely.
So people, you just got to take your time and make sure that what you do is best for you, not best for that agent that's trying to sell you something.
Yeah, true. I think that you said, because we do have the ability to run reruns, and I think that I heard you said that you would not be here next week, but you'll be here in 2 weeks because you were going on vacation. I think that's what I heard you say, and everything like that.
Well, we were going to talk about that after we got off the show, but yeah, you're going to have to run a rerun because I'm taking my computer with me, but I am not doing phone calls. I'm going to be fishing, and I hope to catch a redfish that's going to be about this big.
I want you to catch one that big. Only I want it to be that big.
Yeah. So that's what I'm going to do. I'm going to go play, and I will come back, and I will be. You'll think I don't put any sunscreen on. I don't care. I want to get as much sun as I can.
Exactly. Sun is good for us.
Yeah, my Lebanese and Greek will be coming out.
The Lebanese and the Greek.
Yes.
Cool.
Okay.
All right. Sounds good. Another great show. You gave some great information and all along those lines. So I'm going to play this commercial about an advertising agency and then get us on out of here and everything like that, and maybe an education one as well. But as always, you gave great information, and I look forward to seeing you in the second week of August, because that'll be the second week of August where you come back and everything like that.
Okay. I'll talk to you later. See you later. Adios.
Adios.
Hasta luego.
Hasta luego and all of that stuff.
Okay. Bye.
The only trick you need to save time and money is to shop at Aldi. Aldi. Shop differently. Limitless length plus volume. Sensational from every angle. New Lash Sensational Sky High Mascara. Only from Maybelline, New York. Everything that touches your baby should be this comforting. Pampers Swaddlers. The #1 choice of hospitals is 2 times softer. All right, Trivago. Find me a hotel somewhere in Thailand where I can wake up with a view of the ocean. Awesome. The future. It's impossible to see. And when it's finally here, it might not be what you'd expect. It might just be better. Introducing Luxury Electric. Introducing Lucid Air. We're for those who love to discover, who don't need to travel to find something new, and who know when you spend less, you can discover even more at TJ Maxx and Marshalls. Smooth, velvety chocolate wrapped in precious gold. Ferrero Rocher.
I want to thank everyone for coming to the 2020 TAF Awards. This was a show like no other, people. This is the Grammys for dignitaries, educators, and support staff around the state of Oklahoma and worldwide. We cannot do this without the support of the people. So we thank you, I thank you, for being such a dedicated supporter to this movement for the Teachers Appreciation Foundation. I thank you.
If you're talking, they will hear you.
We all want our kids to grow up safe and healthy, so we show them how. And we tell them with honest conversations that let them know what we expect. Not just one time, but every chance we get. That's especially important when it comes to alcohol and other drugs. Kids not only need to know the dangers and how to avoid them, they need to hear it often from you. And when it comes to pain medications, opioids, they need to know that they should never be taken without a prescription and never shared with friends or family. It's dangerous and illegal. So talk with your kids and guide them through the challenges of growing up safe and healthy. Because when you talk, they hear you. For more information about talking with your kids about underage use of alcohol and other drugs, visit underagedrinking.samhsa.gov.
So stop it here. You can do it if you try.